right, this is Frank Vocci. I'm at the ASAM meeting with Dr. Senthil. Dr. Senthil came from India to give us a talk, and his talk was on the relationship between treatment of alcoholism with or without comorbid depression. Would you describe the study for us and what you saw?
Thank you, Dr. Frank Rashi. So, I'm from India. I'm Dr. Senthil Vel Rajan. My study is regarding how alcohol dependence influences the treatment of unipolar depression in the short term, especially with regard to remission part of it. Not with regard to remission, but with regard to response part of it.
Okay.
Because, like, on the short term, does alcohol dependence syndrome influence the treatment outcomes of unipolar depression? Like, we compared groups of patients, like with alcohol dependence and without alcohol dependence, both suffering from unipolar depression, and we followed them over a period of 1 year at baseline, 3 months, 6 months, 9 months, and 12 months. What we found was, it's quite surprising. Like, many people were surprised by the results. Like, there was no significant difference between the two groups. But of course, what we found was the set of patients, like, who took, like, who had the comorbidity, they've had multiple episodes of depression earlier, and on the short term there was no difference, but probably on the long term, with respect to achieving remission and with regard to the severity of depressive episodes, there might be an effect which needs to be followed up. And regarding the prescription patterns, like, the researcher or the principal investigator was totally blind to what kind of antidepressant that was prescribed. So we were quite sure, like, it was left to the consultant's discretion, like whichever the treating physician's discretion. So we're not biased towards what drug works in which patient, or to try whichever drug. With regard to actually whether the chicken came first or the egg came first, so we just followed them for a period of time, and quite a number of patients were abstinent, and whoever actually continued to have depression. So we could actually make out that is an independent unipolar depressive disorder.
Yes.
Like, a total of around 93 patients were followed up. Unfortunately, like, 73 only could be taken into the study because of various exclusion criteria. And of the 73, like, 21% had comorbidity, alcohol dependence syndrome. So we didn't go into the tobacco stuff because that would have inflated the data. So we looked only into the alcohol dependence syndrome. Then what we came out was, like, out of these 21%, predominantly they were males. Okay, like, like, because of cultural issues and the stuff. There was a significant dropout rate. It's quite unfortunate because, and we did try to follow them through the telephonic conversation, and only 17 patients were able to complete the study. That's 5-time follow-up study. Like, we did, we administered 8 scales, like Hamilton Depression Scale, Hamilton Anxiety Scale, Somatoform Checklist. That is to cover somatic symptoms in depression.
Okay, so using those scales, were your patients moderately depressed or moderately severely or severely depressed?
Exactly. So they were moderate depression or severe depression. We didn't look into the mild depressive patients. Like, they were diagnosed based on ICD-10 criteria.
Okay.
And we just mainly looked into the moderate depression with somatic symptoms, without somatic symptoms, somatic syndrome, and then this severe depression. So majority of them, they belong to the moderate depression category.
Okay, so how far did you have to get a drop in the scale to consider it to be a remission?
Okay, HAMDs, we used HAMD, and less than 7, we considered as remission.
Oh, very good. Okay.
So 50% drop from the initial score was considered as a response.
Okay.
And quite a few of them, majority of them achieved remission by the end of 12 months. Like, even though there was significant dropout rate during the course of the study, we used last observation carried forward method, LOCF method, and we found, like, it was pretty, as like the previous studies, like, you can say the duration of unipolar depression is well within 1 year, like 9 months to 12 months. So That was expected, but on the short term, we didn't find any difference between the two groups.
Okay.
So, yeah.
Right. So, how are your results consistent or inconsistent with the existing literature?
Yeah, that's fine. Like, as per the study trial, we looked at the study trial, and Davis et al. They have also mentioned the same thing. Like, on the short term, it does not influence the treatment outcomes. But on the long term, people tend to experience more severe depressive episodes, more comorbidity, more disability, and a number of days lost in work. That's that thing is to be followed up. Like our study was done for a period of 1 year, and we're continuing with the study.
Okay, very
so
good.
probably you can come out with a much long-term data.
Yeah, you'll have longer-term data as you follow these folks through. Very good. Now, the antidepressants use, are there a variety of antidepressants, or mostly SSRIs or SNRIs?
Exactly. Like with regards to the alcohol dependence part, whoever came, it's a tertiary care center. So whoever the patient benefit was the topmost priority. So we need to give the discretion of and the choice of antidepressants is left to the consultant. So at the end of the study, we did see the number of the type of antidepressant that was used. Mainly, it was like SSRIs, the fluoxetine, sertraline, and even venlafaxine. Majority of SSRIs. And for treating this, to reduce alcohol craving, naltrexone were used.
Very good. So you're coming back next year to tell us more of the...
Yeah, exactly. Yeah, sure.
Okay, all right.
Sure.
We'll see you then. Thanks a lot.
Sure, thank you.